Congratulations, into a health alert we were the first to raise the red flag about 5 years ago. We asked the FDA to release information about the long-term effects of corrective laser eye surgeries, which they did. Now we're investigating the disturbing link between suicide and these eye procedures, these surgeries that promise to make your vision go from this to this, but is leaving some people seeing this and in constant crippling pain. And it recently claimed the life of a beloved meteorologist who took her own life 2 months after the surgery.
I'm struggling a little bit, so I do still need all the prayers and the well wishes, because this is a hard go. The doctor said it could take up to 3 months or so before I feel like 100% again.
That's beloved Detroit meteorologist Jessica Starr, sharing the pain she was in after complications from a newer Lasik type surgery. Jessica struggled with poor eyesight all her life, and after the surgery, the mother of two tweeted that her recovery was a struggle and a challenging time. Jessica never recovered. Last December, she took her own life. Her death has raised questions about the disturbing link between laser eye surgeries and suicide as more cases emerge. In October, Canadian TV reported Paul Fitzpatrick, father of two, took his own life, blaming the laser eye surgery he went through back in 1996. In a suicide note he wrote, since 1996, pain, pain, and more pain. Please forgive me for not being strong enough to cope. The past few months have been unbearable. Every year, about 600,000 people get Lasik, many lured by the ads. But a new FDA study revealed Lasik risks were higher than some originally thought.
If you type into Google Lasik complications, you'll get pages and pages. You can never predict when an eye is going to go wrong after Lasik.
Here's what can go wrong. Patients may achieve 20/20 vision on an eye chart, but be seeing that chart in double, or seeing halos or starbursts, especially at night. And the most concerning problem of all, dry eye pain. So severe that some people have committed suicide.
All he would talk about was his eye pain and his eyes and how he couldn't live that way, and it eventually cost him his life.
In past investigations, we went undercover to see what Lasik centers tell patients in person.
Could I really toss away my glasses, like he had to say?
You can, yes. 30 to 15 minutes. Right after that, you don't need to watch it at all.
We have the technology to get rid of reading glasses and distance glasses.
Really?
It's pretty
And when we asked about side effects, the Lasik specialists downplayed them.
Are dry eyes temporary?
It is. It's not that common. I'd say it happens in probably less than 5% of the population.
I shouldn't worry about the night vision. Okay.
I wouldn't want to say 0, but certainly less than 1% chance.
Today, what do you need to know about laser eye surgery? Joining us are Sarah, who wished she'd never had eye surgery 3 years ago, and Paula, a patient turned advocate who says Lasik destroyed her eyesight and left her with chronic pain. We're going to start with Sarah. Why did you decide to get the Lasik procedure?
It was pretty simple for me. I just wanted to wake up and be able to see without glasses and contacts.
So a few weeks after the operation, you started experiencing some symptoms.
Yes, right after the operation, I could see 20/20, I still do, but I immediately had dry eye. It just kept getting worse and worse. It eventually turned into corneal neuralgia, which is basically nerve damage, nerve pain. So I take something every day for the pain. I put in eye drops 8 times a day for the past 3 years.
So it's important to know some of the risks of Lasik. There's the dry eyes and the pain, that Sarah just described. There's also visual aberrations like seeing double, which looks like this, right? Or glares. And glares, again, like looking at the sun, but it's not really the sun causing this. There's halos, so you'll see little rings around lights. And then there's starbursts, which are especially problematic if you're driving. Sarah, were you informed of any of these risks?
I remember when I was reading my consent form, it said something like 1% chance patients get dry eyes, and then it listed the things you just listed, but I had no idea what that was.
The 1% complication rate, which was also in that little tape piece, said to us by a doctor is what I had always heard as well. We're going to challenge that number for good reason. I don't think anyone really believes that number anymore.
No.
But the issue that really got my attention was the pain that has led to, we believe, suicides and life-destroying challenges.
Yeah.
How bad is your pain, Vid?
It's really hard to explain if you don't have it, but it's this burning, deep, intense pain. It's kind of like there's like a toothache in your eye, and it's not something anybody would want to live with.
I understand you considered some drastic measures because of it.
I completely understand someone wanting to kill themselves over it, because when I was at my worst, I told myself if I don't get better, if I don't find a way to get rid of this pain, I don't want to live anymore. How can someone live like that?
So, you're not the only person we spoke to, obviously. We spoke to a lot of folks. Others have experienced the same excruciating pain. One woman we spoke to lost her eye as a result of this surgery. And I want to get Paul into this conversation. You had your Lasik surgery 18 years ago.
That's right.
And you've been living with long-term side effects from that procedure.
That's correct.
Let's start with your vision. Is it 20/20?
My vision, if I sat down and looked at an eye chart in a doctor's office, I might be able to make out the 20/30 line with both eyes open, but my vision was a complete train wreck. Massive starburst, halos, multiple images. I could look up at the moon at night and see up to 8 smeared, overlapping moons with a massive halo around the whole thing. It was just ghastly. And that was considered as a success.
And were you warned at all about these complications?
I was given a single sheet consent form, front and back, and it listed a lot of different complications that could arise, but it never said anything about permanent, chronic. Those words were not used. Everything was dismissed as temporary side effects. It'll get better, give it time. No one ever told me that I could be visually disabled for life.
So what do you want people watching right now to know about what you went through?
I want people to understand this surgery is not as safe as it is portrayed. It is not like going to get a manicure or a haircut. It's a dangerous surgery. It's a risky surgery. It's an inherently harmful surgery. I wish people understood that.
All right, so when we come back, our investigation continues. Do we know enough about the risks of this surgery and the suicides that we're reading about? Are complications from this popular surgery more common than we thought?
Because this will. The V is for vegetables. Drink some.
The dry eyes that you get from Lasik, they don't go away. I'm 19 years post-op, and I still have horrible headaches, dry eye pain. I spend so much money on eye drops, ointments, supplements, anything to just make the pain stop.
We're back investigating the disturbing emerging link between laser eye surgeries and big complications that sometimes result in suicide. Do we know enough about the long-term side effects of the world's most popular elective surgery? Ophthalmologist Dr. Yuna Rappaport joins us. She not only performs Lasik, she had the procedure done on her own eyes. That was important for me because a lot of doctors haven't had it done themselves, and you took that step. What do you, and some ophthalmologists are reporting very low incidences of complications. But we're hearing more and more studies, reports of people having big problems, again, in these suicides. What do you make of these?
Yeah, I mean, suicide is definitely a very serious and devastating issue, and it's under-discussed in society in general. Those patients who committed suicide, their families definitely deserve a voice. They were unhappy with their outcome, and they had severe pain and issues that led to that. I think that as physicians, we want to hear from these patients because our role as physicians is to care for patients, optimize outcomes, and treat complications. And in some of the studies, they found that patients didn't report all their complications to their physicians. So I think the takeaway message for me is I would want to know if any of my patients were experiencing things that were so unbearable that led to these.
That might explain part of the gap. We've been talking to people, you've been hearing people complain quite loudly about like they had complications far beyond what they expected.
So if you can't explain to us LASIK, which I know is just maybe half of all the total corrective procedures that are done, so people get an idea of what's going on. And maybe when you do this, you can explain why some of these complications, especially the dry eyes and nerve damage, are happening.
Sure. So LASIK is just one of many types of refractive corrective procedures, but it is the most common. So in LASIK, a laser creates a flap.
So you actually cut into the cornea here.
It's created with a laser, right, no blade, and then it's lifted. That flap is about 100, 110 microns. The flap is lifted. The laser then ablates or changes the shape of the cornea right here, the surface.
I'm sure that laser is shaving off tiny bits of a 0.5 millimeter thickness material.
Even microns. Tiny, tiny, tiny. So it shaves it, and it's custom performed to the patient's prescription. So everything is custom done. And then the flap is put back down. So that is what LASIK is. Whenever you lift the flap, you are going through corneal nerves. And for some patients, that does result in worsening dry eye and corneal damage later on.
So when we first heard about the complications of LASIK, the industry said there was a complication rate of less than 1%. That's what I was told. And it seems surprising to me because I was hearing about it so much, I thought maybe I spoke to everyone who had a complication. But when we looked at the published reports, the actual incidence was about 20%. Now, since we did our first show, the FDA did a clinical trial, and here's what they found. Most people who had visual problems prior to LASIK actually improved after the surgery. So that part seems to be pretty good and legitimate. The vast majority of folks are pleased with results. But, this is a big but, about 30 to 40% of people without problems to start with reported problems 3 months after LASIK surgery. So let's walk over and join our two women who've had unsuccessful LASIK surgery. If an ophthalmologist quoted a complication rate or a side effect rate for, let's say, 3 months, is the right number 20%?
They don't report it accurately. I'm sure that I'm a success in where I went and got my surgery because I can see 20/20, and they don't. The dry eye was just a side effect. It's not taken seriously.
So you're both success stories then?
Yes. I can tell you they use what I call fuzzy LASIK math to get these numbers.
So we reached out to the FDA for comment, and here's what they said in part. The FDA's work with LASIK is ongoing. We are also in the process of developing a LASIK patient labeling guidance that will provide recommendations to industry about how to clearly communicate risks of LASIK to patients. The Academy of Ophthalmology says LASIK is not for everyone. They agree with what you're saying. And we reached out for a statement. Here's what they said in part. The risks of LASIK surgery are known to the ophthalmology community. More than 300 peer-reviewed studies have shown that on average 95% of patients are satisfied with their outcome after LASIK surgery. But the FDA study found that 30 to 40% of people without problems start to report problems after LASIK surgery. So Dr. Rappaport, how do you reconcile those numbers? How can 95% of people be happy, but 30 to 40% are reporting complications?
Those are short-term statistics. 1 month, 3 months, no more than 6 months. They want you to look at short-term satisfaction. They don't want you to look at long-term safety and efficacy. They want you to look at short-term.
Do you agree, Dr. Rappaport?
I agree. I think the point is that this is one snapshot in time that they conducted in questionnaires. It'd be interesting to see the statistics at a year, at 5 years, at 10 years.
Dr. Rappaport, thank you very much. I really appreciate you spending time with us today. I know it's been a very difficult road for you. I wish you the best.
Thank you.
We'll be right back.
Comedian Jay Leno pays us a house call. They recently found